Thank you, and thanks, Carla, for inviting me. And I didn't put much of my slides on the ASF because I thought Scott was going to cover a little bit more, but we'll go from there. And there's a ton of info on here. You'll see a lot of links because I just wanted to touch on some of the major global efforts and help you understand how that actually impacts us, both our government as regs that they do, as well as from the farm level. So first I want to start with what are transboundary animal diseases, or TADs. And that was a term we don't normally talk about here. I didn't know until I went to work for FAO and had to cover my ignorance. And these are some of the official definitions from the global level. And as we know, they cross boundaries, they travel long distances, they usually have a high impact on the animal population. Sometimes they have a human health component, and they all cause economic damage. And that's a cute little Kansas kid. He's about 18 now. He'd hate that his picture's still up there. But so in general, for our U.S. purposes, it's not 100% accurate, but basically TADs are what we generally talk about as foreign animal diseases for us. And I've put some of the biggest ones on there. The Peste du petit ruminant, my French is bad. That actually affects about 80% of the small ruminant population in the globe. We don't talk about it here. I can't get any small ruminant guy or gal interested in working on that because we just don't have it. But it's a tremendous negative economic impact around the globe. Oh, by the way, this is Rift Valley fever. Actually Rift Valley, where it was named, northern highlands of Kenya, looking over Rift Valley. I'm a little kid from West Texas, never thought I'd be there. And so that's a picture I took a couple of years ago. So here's the big thing to find information. The major players on doing TADS work is FAO, Food and Ag Organization, as Carla mentioned, and then the OIE, the World Organization for Animal Health. They write the international standards for how you safely move livestock and products around the globe. Also, they do some standards on lab testing and other things. FAO is the technical arm, Food and Ag Organization, part of the huge United Nations, and they cover the gamut on agriculture and water and nutrition. They're headquartered in Rome. That's where I worked for a few years. And they really provide the technical expertise to countries. And our government is the largest funder of FAO, and including their animal health program, working on these diseases as well. Other main one, especially for FMD, the World Reference Lab, Pirbright, it's in the UK. They do monthly reports. This map at the top, that's from their last report. You can sign up for free on their website where you automatically get the reports. I encourage you to do that. It gives you a good picture of how FMD, what's going on in the world and the latest occurrences. Within the FAO is the European Commission for Control of Foot and Mouth Disease, or EUFMD. While they're located at FAO, they have a different governing body. The European Commission started them 20, 30 years ago. Basically, they were worried about what countries were going to give them FMD, so they decided to go out and help those countries control it or eradicate it, decrease that threat to the Europe. They have about a $15 million a year research arm as well, but their main focus is helping those countries develop the capacity and training and needs of to decrease that threat. And actually, I'm currently working with them, worked with them a few years ago to do a field study, vaccine trial for some of our, we had a FMD vaccine talk earlier. So if we needed to prove that a vaccine is going to work in our situation, what kind of field study needs to be done. We're also going to start offering real hands-on training for veterinarians, the real veterinarians in the field, our private practitioners, some producers, and our state and federal vets as well, and that'll be later this summer. The tripartite GLUES, Global Early Warning, technically it's really World Health Organization, FAO, and OIE. They're supposed to be working together to get information from all sources, official unofficial rumors, and put out information on a regular basis. That, I would say it hasn't worked as well as it was envisioned, but it is improving, so I would sign up for their updates as well. And they put a lot of stuff on ASF the last 6 months. And all of these things work through this global framework for the control of TADs, and that is both FAO and OIE. When there's a human health component, WHO gets involved, but structurally how all the different strategic plans and all the efforts is done through this GF-TADS, and that gets the political support as well. And why do we care? Left side, big picture. Food security, food safety, human animal health, economic stability. If you look at the parts of the world where we have conflict and severe conflict, their agriculture sectors were decimated and people were hungry and other things happened. Our Department of Defense and other defense-related agencies in the U.S. actually spend a lot of our taxpayer dollars working on decreasing animal health issues in those countries to hopefully improve the stability and decrease our risk. But the daily impact is more what we talk about here when we're worried about programs. And how would that affect, if foreign animal disease affect our rural economies, our farm families, our food safety, our food security, all the allied industry, the stress, financial and otherwise, on our state animal health officials and all the people working at the state level as well. Diseases cost money. So this is a sampling of those international players I just went over. They all do a ton of reports. They're all free. The tripartite I'll talk about a little bit later. There's also, I put the Plant Protection Convention in there because don't forget plants. There's also an international standard setting body for them as well. Here's a couple of the big players, and I put these in here because all of those, if you have a global strategy or a country strategy or a regional strategy on some of these TADs, they have to get political support and have a mechanism. We don't see that so much here with Canada, U.S., Mexico. We do a little bit, but in the rest of the world, especially if you had low, mid, and higher income countries, they need a structure like this to get the political support and move things through, prioritize. So there's the main ones in this Southeast Asia or SARC one. It was started in '85. There's 8 countries, and that includes Afghanistan, Bangladesh, India, Sri Lanka, Pakistan. Association of Southeast Asian Nations actually started in 1967, and there's 10 countries. Cambodia, Indonesia, Laos, Philippines, Vietnam, etc. And they have both political clout as well as they organize the working groups for how that region in each country is going to implement some of these animal health eradication plans, surveillance plans, and also have funds to help them do it. Inter-African Bureau for Animal Resources, or AU-IBAR, they're in Africa. They're both a regional economic body. They approve the vaccines in Africa that are going to be used. They have oversight of that, as well as they do some research. And if you don't get their support for any of these control programs or strategies, it's not going to happen. REMISS is a newer one that came out of, remember the first pandemic threat from 2000 to 2010 or so, and it was in about 60 countries. REMISS came probably, I think it was, 2009, but they started talking about 2006 that there were some countries in the Western Mediterranean that high-path AI was just everywhere, and they wanted to kind of get together and work on that. And a lot of these are based on political ideologies, but also trade is how they were set up. Now, for our U.S. relevant entities, so the Quads group is one that our governments, those 4 governments work together on all these issues. In fact, the Quads group in 2014 made an announcement they were going to recognize each other's regionalization for FMD And they were also going to work on how they would share a vaccine in case one of these countries got FMD, then how maybe each could support the other to share some of their stocks. And Scott, I'm glad you brought up for CFIA and what you talked about with Mexico, Canada, and us. This is only U.S. and Canada. This started over a decade ago. How do we kind of align our regulations on, it's not just animal health, but other things on some of these major topics? And that would be for ASF or any that goes through that council. And then, of course, you have, I'll put USHA, could have put any other NIAA as well. It's more about the National Assembly and the state vets and all the work that and the discussions and resolutions that come through that. And then local players. At the end of the day, it comes down to, so you have all this global stuff, and it's great to have strategies, but it's implemented at the local level. And that's both internationally, when there's standards written, then it goes to APHIS for the animal stuff, and you have to, we have to accommodate, and we're a member, so we are supposed to follow those rules. And so then some of our regs, besides Congress telling them what to do, is some of our regs are written because to be in line with these agreements we've done. And all the way, I put these quotes, or I wrote these two things on there because you can have the best plans in the world, you can have great regulatory infrastructures, you can have everything you need, but at the individual farm level, that person doesn't follow what they needed to do that day. Or at our ports, when that inspector's just tired and he just waves something through. And all along the line, it comes down to local all the way to global, and we all have to work together for that. And this is just another slide to talk about. It's kind of long, and Scott and I didn't compare notes, but everybody has to work together, and it truly takes everyone, and no one's more important than the other. And to be aware of what's going on with the others helps you for yours. So just a couple of tads real quick. As y'all know, rinderpest was declared global freedom in 2011. It was a tremendous campaign and over 20 years of concentrated work, especially the last decade. And that's why OIE was formed, actually, because of rinderpest. And there's post-rinderpest activities, and those started in 2011, even before it was announced freedom. And I mention this because we have a couple of U.S. people on there. Mo Salmon from Colorado State's been on. There's a working group that's a formal, official OIE FAO. The secretariat sits at FAO. And even though we've gotten rid of the virus and done their surveillance globally, we knew that a lot of labs around the world had rinderpest virus in their labs. Many of them were not BL3-2 even, or 3. So, and many were in countries that were unstable. So there's been a tremendous effort since then. Canada's funded a lot of it, but our Department of Defense Threat Reduction Agency has funded the significant portion of this to FAO and OIE through this working group are going out providing assistance to those countries and the labs to safely destroy or gather the virus. There's also lessons learned from smallpox because you still need a little bit of virus left to do research. And so they did a how do we safely maintain some, what labs will do it, what's the criteria for it, rules around any kind of holding that and research. And so that's ongoing. And this OIE's done the best. Don't tell FAO this, but they've done the best on, there's some great videos and cartoons, and they launched this campaign last year. I encourage y'all to go look at it. One piece of that was, because I was there, we wrote in, we also want to educate the veterinarians and producers of the future. So when all the folks, most of the people who really did the hard work on this are in their 80s and 90s or passed away. So we want to make sure folks in the future know what rinderpest looks like, and we're still educating on that. Hypatia, I'm not going to go over. Y'all have known one of those things. This is one of my favorite places to have a aperitivo in Rome. It's the Pantheon. One thing, though, is, so the main pandemic that had a global strategy H7N9 in China, that was in 2013. We actually did another strategy. We did a risk assessment, too, of all the 7 countries around China, both legal and illegal pathways of potential spread. And since then, there's been increased surveillance in those countries. And so far, it hasn't gone out. But I was looking on the ASF spread out of China. It's pretty similar to what we expected for this H7N9. OFLU is a network for AI and from the vet side that provide advice into the human side. So when WHO figures out every year what they want to put in the vaccines for humans, that started in about 2004 to get information from the field of what's circulating out in the animal side so they can better provide human vaccines. Progressive Control Program, I think it was Charlie earlier today on the resolution and the other, said, oh, well, eradication, that's unachievable. This is a way to get there. It started about a decade ago, a stepwise approach for each country. FAO and OIE's been working through the regional bodies on this. There's regional roadmaps. Countries, they assess the country, they develop a surveillance plan. Once it gets to step 4 is when OIE will officially recognize them. A lot of countries have made a lot of progress. Now, will it happen in the next 10, 20 years? No. But this is the way the world's leaders have decided how to address it, and it's a great approach. FAO's written one for rabies as well as brucellosis. They're not published yet, and when I left in 2014, they were in the final review, so I'm not sure why they haven't been yet, probably politics between the major international organizations. But that approach is a practical one that takes in each country where they are and helps them develop a plan. We could use that for TB here and a few other diseases. PPR I've already covered. The only difference is with this, they learned from Rinderpass and also from FMD. Instead of just focusing on that disease, PPR, which was more recently done, has other components. Because one of the main reasons we have diseases globally is the veterinary services. And we could say that both at the state level as well as the federal level. And I'm not excluding us from that. We need continued improvement in that as well. And then the third part, so you get the producers, the people, most of the people that own small ruminants in these countries are, it's just a few head. It's not commercial like we would think. And you can't just go tell them you need to vaccinate this goat or sheep and everything would be great, because they have all the other daily diseases that they live with. So this plan actually incorporates how do you do a global eradication strategy of a foreign animal or TADS with helping them clean up brucellosis or parasites, et cetera. And that was a major advance forward. ASF, I'm going to mention just a couple of things. A lot of links where you can find current and continually updated, and they'll sign up for those updates. But there was actually a global platform for ASF back in 2013, and it was our Department of Defense who actually funded that. Harry Snelson from Swine Vets and Patrick Webb from National Pork Board were on that. They stayed at my apartment in Rome. I'll never be the same. But it was the first time that those two international orgs actually had producer-type people on one of these. And so it didn't go anywhere after that because they didn't get any funding. We'll see after all this China bit if that gets revived. But that was a program of how do we prevent it, respond, have the tools, etc. China actually, before China had their case, there was this rapid risk assessment that FAO and OIE had done with their government last year in March. Since then, they've also set up a working group, which is in that second OIE resources. And again, this is going through that GFTADS. Okay, this isn't a foreign animal disease. You could argue over a beer that it may be a TAD, right? So, and I'll put it on here because I want you to know about things that are happening around the globe that actually impact us. So The tripartite I mentioned earlier, that's FAO, OIE, WHO. For 20 years, they've had an agreement. In 2012-13, they rewrote their agreement. There's 3 topics they're working on: One Health, rabies, and AMR. But despite that, they all came out with their own plans. And WHO kind of stabbed FAO and OIE in the back and came up with a plan, said they were for it. It was right before our Codex group, and there were things in there that were not scientifically valid and not helpful for the animal side. OIE, additionally, they have annual reports that they ask their member countries of. There's a lot of good info. It's only been going on about 3 years, and we're learning what regulations those countries have, what infrastructure they have, what kind of data they're getting back. So there's an effort to know where we are, do consistent type of data, so then we can make a better plan going forward. Those do, if countries are okay, they're public. Also, OIE's done analysis on the regulatory infrastructures, both for animal health, and they include antibiotics in there. The process verified program, it's performance of veterinary services, so a country will ask them, will you come and evaluate our veterinary services? And they identify the gaps. That's all been done. Many of them are public. As well, OIE is now going to how do we help countries fill those gaps. I would say that if we ask OIE to look at ours, we might have some gaps that they identify as well. And we wouldn't have to make it public. But that might be a good exercise. Also, FAO, most of the world, the donors are given FAO money to go actually help each country make their own national action plan on AMR. The U.S. has already done ours from our across government level, and as Sarah, I think, or I don't know, somebody mentioned today, there's actually a USDA one as well, and that fits under our U.S. government action plan. And that's one of my favorite times at Trevi, late at night when there's no tourists, but it's beautiful. So again, why do we care? Because we want to decrease the risk to us. The more we know about what's going on around the world and what viruses are circulating, our risk pathways, the better it helps us prepare and allocate resources, both personnel and financial, both at the federal, state, and even from the producer level as well. Because that's what we want to do. We want to fill in the gaps. We need to better prepare, prevent, and respond if we do get it. FADPREP's our U.S. government one for FMD. Made a lot of progress. There's a lot of holes in there, and a lot of the holes are putting it on the state vets to figure out how to do it. We need to continue to fill those gaps and not wait till we're in crisis mode. Secure supply plans. I presented on those a couple of years ago. EU FMD has an open session every other year where it's the world's best scientists that come for that work on FMD, but also work in the field. It's not just the lab folks. I'd encourage y'all to go. They're usually incredible locations, and I learn way more than the price of the plane ticket. But I presented on our secure supply plans because the OIE is changing their FMD chapter. I think we vote on it this May to allow the concept of compartmentalization. So they've always had regionalization. Those of you in high-path AI states, in effect, y'all did some compartmentalization if you allowed eggs or other things to keep going, moving in commerce. And we're going to vote, our governments are going to vote on that. And compartmentalization is this group of animals have been handled the same way, in the same manner, and you can document that they don't have the disease and they don't have a risk of spreading it if we allow them to continue moving in commerce regionally or internationally. The support has been really positive on those international discussions, and I think our secure supply plans, if they were really implemented more robust, this would be a way that if we got FMD, we could still have some of our producers and states maintain some economic viability in the face of that in our country. So I want you to pay attention to it because it'll be important. And I have the Tysons and Cargills of the world are aware of it. And then the two on the right, I just want to leave you things to think about. So one, for the swine folks, because of their structure, they've been able to do a lot of things through their National Pork Board. So Swine Health Information Center, awesome. I think it's done exactly what they wanted it to do. Also, over 10 years ago now, as we look at our regulatory diseases, pseudorabies, brucellosis, TB, we're moving from regulatory disease by disease to more comprehensive. And these two links were ones that, the first one was a swine meeting that I helped with a couple of years ago to talk about a comprehensive swine surveillance plan. What does that mean? All of the logistics of it. They're further along because they've been working on it a decade. Our U.S. government's thinking through those things as well. We had a cattle one a couple of years ago, too, that several of you in this room were there, starting from ground zero on what do we, as we go from regulatory by regulatory, disease-specific, to something more comprehensive for cattle health in this country, what would that look like? So I encourage you to continue thinking about that. I think the days are over of disease-specific. The resources aren't there. And then what I hear, no matter where I am, internationally or home, farm-level biosecurity. So these secure supply plans have biosecurity written in them. The great vets I've talked to at the feeder sector that are trying to help their feed yards implement those, they say it's very difficult. And I've asked, is it because we wrote it wrong or why? And I had vets just last week say, to add something else into my day to work with the producer to do for a foreign animal disease that we may not get, how do I justify that time? So I think we need to think about, especially for biosecurity, for both the producer and the veterinarians, it's not something extra. How do we incorporate what we do every day for biosecurity? Just to herd health for everyday needs and endemic things, and increase profitability, then what extra do we just need to add on in the event of a foreign animal disease? That's my soapbox for the day. And it's springtime in Texas, and this was taken a few years ago. Actually, when I lived in Rome and I was missing home, and a friend sent that from a farm to market road in Texas. So I'd be happy to answer any questions. They're bluebonnets, and I showed this slide in New Zealand, and there was a gasp from the crowd because it's an invasive species there. But I was talking on animal ID at that time, so it was a perfect point for the differences in philosophies on animal ID.
Questions for Elizabeth? We got time for questions.
You gonna let me off easy, Dusty?
No, I'm going to ask a question again before you started. So it's fascinating that you've now spent time was it with the FAO in Rome? Mm-hmm. And thinking about these disease problems globally. So of all the things that you've looked at and the different efforts that are going on, what do you think is the biggest takeaway from that everyone here needs to know and needs to share with somebody else?
I think the biggest takeaway is we're all very similar, and it comes down to every day, everybody doing their job and having the knowledge and skills to do it. So, and several of y'all have traveled internationally. There's more similarities than differences. We are so lucky here in the U.S. that we have infrastructure. We have that feedback mechanism for our government to. I can call Sarah up and say, Sarah, okay, we are not happy the way you are doing stuff, and she can say, well, we're not happy the way you are doing stuff. And there's a Federal Register notice, and there's previously decades of research that was done that we've benefited from. These international organizations are trying to help that for some of these countries, and our government's funding a lot. Canada, Japan, a lot of the Western are funding it. But at the end of the day, I think we have more similarities than differences.